Hi there. Um, First off, I'd like to take an opportunity to introduce myself. My name is Rachel Martens. I am a research engagement strategist with the Family Engagement in Research Training Program. Now, this is a program that is run by two different organizations. That is CanChild Center for Childhood Disability Research, as well as Kids Brain Health Network. And today I wanted to talk a little bit about my own experiences as somebody with lived experience and what that has meant to be a partner in research. So, just to fill you in a little bit about myself, I'm from Calgary. I've been involved in research as a partner, but also in some aspects as a strategist now for about 8 years. I have actually, since I put these slides together, I have now finished my first aspect of subspecialty, which is Canadian healthcare, as well as mobilizing knowledge, which is essentially the practice of moving knowledge out into the world. I am also a two-time cancer survivor and also a former medical mom. And if you are unfamiliar with the term medical mom, it's sort of a jargon about that some parents use who have children who are often frequent flyers in pediatric healthcare. Unfortunately, my son passed away in 2020, but that offered me a lot of experiences within the Canadian healthcare system. And this is my son, Luke. He's the one who passed away. Luke was born with a very rare chromosome diagnosis called mosaic trisomy 22. Basically, it meant that he had a third copy of his 22nd chromosome, which meant that he was born very, very small for his age. He was quite significantly disabled, but he was also sharp as a tack, super funny, and loved to play pranks on people. And loved also to commit trouble in his wheelchair as well too. And so the reason why we are here today is that the idea of partnering in research, well, we talk about research all the time as participating as subjects, people upon which they take your information and make it into a study or in one capacity or another. What I want to talk about today is a different aspect that has been embedded in Canada for a short-ish amount of time, but in terms of educating more people on the concept, there is really not a lot. It still remains quite a secret. I'll be quite honest. That's kind of a basic description, but we'll dig into this here today. So when we talk about public engagement, which is one term that I want to kind of impress upon you today as part of the introduction to what we're talking about here. This is where essentially researchers go out and they find people with lived experience and they ask them a whole bunch of questions about a particular research question. And the people obviously give them all that information. And the researchers go out and they take all of that information and they put it all together and they publish a study. That's kind of the short version of what public engagement ends up being. Now, patient-oriented research, and you might hear a number of different terms actually used with it. Family engagement is another one. But at its core, in terms of the things that we use from a policy level, patient-oriented research is kind of the standard description of using people with lived experience as partners in studies. So how that works essentially is that researchers go out and find a few people who with lived experience who have an invested interest in seeing a particular type of research project fulfilled. And then the researchers and the people with lived experience work together and reciprocate within a relationship, developing all the details. They can work on things like developing the research question, filling out grant applications. You can basically involve lived experience in virtually every facet of the research experience. And what they do then is they find other people with lived experience in that area and they engage them in a public engaged format in whatever capacity that may need with the particular study that they're working on. And then together they work on taking all that information and then they put that into the context of whatever study that they are looking to publish. In fact, you can actually see co-authorship being an option in many cases. There's a few studies where my name is listed as a co-author in published studies. So what is patient-oriented research? Well, at its root, it engages patients as partners. It also focuses on priorities that are set by people with lived experience because they know what they need in order to promote and improve outcomes that people with lived experience want to see in that particular context. And it's also often uses a lot of different teams of people who may have a particular interest in a particular type of study. Um, some of them can be quite large, in fact, as well too, depending on what the subject matter that you're looking to analyze. Um, it also aims to apply the knowledge that is generated from the people with lived experience to improve healthcare systems and practice. And it's used in a lot of different areas of research. And what's very unique about that is that essentially you end up creating a better research because you have the people who have the basic values that end up utilizing this information in their own lives. And that helps to create an improved trajectory as to how research is supposed to look because it's more meaningful to the people because it talks about their lives and it reflects their lives in it. But it also has their fingerprints on it as well too, which is just such a brilliant thing when you think about it in terms of moving things that you're so heavily invested by. And so one aspect that is a part of the research process is something called knowledge translation. And that can also be a helpful aspect that that people with lived experience can help with as well too, because well, while this graphic mentions researchers, it really should be people with lived experience here as well too, because when they move information into a simplified way that is understandable for people who are looking to create some sort of societal change or social change, like policymakers, decision makers, things like that. Um, People work as partners, so researchers as well as people with lived experience become that bridge towards creating knowledge that is meaningful and understandable for people to create that social change as well. So patient-oriented research is still very much a newish concept, as I mentioned. So the organization that works as the funding body for health research, which is the Canadian Institute for Health Research, so that's the CIHR, they created guidelines for an organization called SPORE, which is the Strategy for Patient-Oriented Research. They created their basic guidelines back in 2010. And now things have moved more towards creating courses to help people work through the processes. And that's training researchers to how to do this well, but also people with lived experience as well too. And that's come up with a number of different um, training modules and things like that, including the family engagement and research course, which I work with. Um, that kind of helps to ensure that this is a value that is set by so many, but at the same time that we're also doing this well and not in a harmful fashion as well. And there was even something like an actual journal developed called the Research Involvement and Engagement Journal, which helps to reflect some of those best practices. And things that we have kind of continuing in development is a national training entity in Canada, which is also continuing to help people train in this type of work as well too with patient-oriented research. So who is doing this work? Well, let's talk about a few of the names. I did kind of describe a little bit about that. So we have community organizations can sometimes be involved in patient-oriented research, diagnosis organizations, things like that. Canadian universities participate in this as well too, though not everybody. This is still at kind of its very base of value system that people have. Now there has obviously, as I mentioned in the previous slide, structures that are being developed, but at the same time, not everybody is doing it. In many cases, it should happen, but at the same time, not. It's still an emerging topic in many ways, I guess is kind of what I'm trying to say here. But as I mentioned, there are the two organizations here on the left, the SPORE, Strategy for Patient-Oriented Research. They have satellite organizations across Canada. So I think almost every province now has a SPORE satellite network. So if you were to Google SPORE Alberta, for example, you would find the SPORE Alberta website, and there's a good chance you could find a lot of opportunities there as well too. So that's one way to Google opportunities if you have an interest after watching this video. Then there's also the Canadian Institute for Health Research. Now that is the funding body for a lot of health research, but it's also split into different practices. So for me, a lot of the people that I connect with are in pediatrics. And so there is one where it's a very long acronym about child and youth health, but everyone calls it IDSI. So they work with a lot of the scientific research that goes on for children and youth. And there's ones for things like pain, rare disease, cancer, things like that. They're all readily available. So now the next question ends up being, how do I join a study? Well, the answer, unfortunately, is it's kind of complicated. Where to start? I hope I can kind of share a few things. Will also add as well too that you can also connect with me through the Twitter account, which is at FER course, if you have any questions after this video. And we can connect and talk a little bit more about that at length. So some of the tips that I can give is to kind of explore the research environment. So I gave you two organizations that actively work in this space. And one thing that can help is to get the newsletter from both in terms of finding new opportunities and things like that that may come about. Sometimes what can help as well too is talking to your physician and ask if they know of any research that is going on that you could participate in. It's not always 100% an answer, but at the same time, it can be a start. You never know. Introducing yourself to investigators as somebody who has an expressed interest in research partnership can also be a potential thing. People don't necessarily ask outright. Sometimes they can't because of privacy issues and things like that. So when you come to them, sometimes relationships and partnerships can develop from things like that. One example actually would be I was being interviewed for a TV special that was going to be on rare disease in Alberta. And I was looking to find somebody because the reporter asked me if I knew anybody who worked in this particular field. And I said, yes, I actually happen to know that there's a specialist in the area who is very smart when it comes to this particular subject. And what they ended up doing was inviting them to the interview. And so the two of us were interviewed at the same time. And what ended up happening was he says, I said, you did a really great job to the specialist. And they said, thank you. I have no idea how I got here. And I said, yeah, that was actually me. And what ended up being happening there was a conversation was generated and a long-term partnership has developed as well too. And that was just one kind of example of what it meant to just ask something a little bit different and setting yourself apart from what's considered the norm when it comes to patient relationships. Saying that you want to be a part of things, you may get a no, but you also never know unless you ask. It's kind of complicated that way, but I think having the courage to try is a really important aspect of this as well. I also mentioned getting newsletters from organizations like Children's Healthcare Canada. If you're invested in pediatrics, you can often find opportunities there as well too. As well as getting your province's SPORE newsletter can definitely help, as well as emailing the organization and mentioning your history as a person with lived experience, and they can perhaps help you find any studies that might be going on as well too. And another tool that can be added to your belt as well too are free programs like Porch, which is in terms of where you're at in terms of learning about research in general. This is like step one in terms of the details of the research process, things like that, where you can kind of gain a greater awareness as to how the process works and what experiences can kind of come about that. When you have a little bit of training under your belt, you end up being a little bit more confident once you eventually do become a part of a research project. And so there's a lot of training, but things fall under a bit of a spectrum. And so once you have a little bit of experience under your belt, one consideration may actually be joining my team with the Family Engagement and Research Training Program and gaining a little bit more depth in terms of your experiences and having an opportunity to try out a research partnership, things like that. So it can be good to try out Porch first to kind of get some research knowledge. And in terms of where the family engagement and research program ends up looking is it can be sort of a next step in terms of feeling out what these relationships can look like. You don't necessarily need to be a partner a research partner or have experience as a research partner, but it's good to understand a little bit about research before you jump into the family engagement and research training program. So the next question ends up being, why partner in health research? And again, it's kind of complicated. Everybody's reason is like a snowflake, unique, beautiful, but also highly individual as well too. For me, having done cancer twice, having raised an incredible young man who had a lot of health complications, all of these things amounted to experiences where I felt like I was essentially trying to balance something in the universe. I can't exactly explain it, but for me, it was a very emotional experience to be able to feel like I could somehow balance some of the challenges that have gone in the way. Like I put something back that's good. I wanted to dent the universe, if you will. Um, Everybody has a different why, and everybody's why may evolve over time, and that is okay. And sometimes there is a point where you feel like you can't do this work anymore, and that is okay as well too. For me, after my son passed away, I realized that my experiences as a parent come with an expiry date because healthcare continues to evolve, and my experiences stopped at one point. And I also knew that it's because of that, and that was okay for me personally. It was nice to be able to educate other people and say this is something that you can do as well too, and see that handed off to other people. And so for me, I don't do a lot of partnering in research anymore, but I am okay with that because I know that I've helped people along the way to start find their voice in that as well, and knowing that that process continues on is very therapeutic to me personally. And even just sharing this video with you today ends up being very therapeutic, because I know that hopefully this inspires somebody to start investigating where they fit in the research world. So I am happy to chat with you anytime. If you catch this video, as I mentioned before, there is my Twitter profile for the Family Engagement in Research Training Program, which is at FER course, or you can email me at Martens, MARTENSR at mcmaster.ca. And I would be happy to connect with you if you have any questions at all. This is this process can be one that is quite the learning experience for so many reasons. And I hope that as you discover now that this is a concept that exists, that you really try to enjoy the journey as well too, as you explore your why and why it's important for you to connect and partner in research as well too. Thank you.